Hi, my name is Minerva Orellana. I'm a PhD candidate in the Clinical and Translational Science track at the Mayo Clinic Graduate School of Biomedical Science in Rochester, Minnesota. And this is aim one of my dissertation project. I want to understand uterine fibroids and menstrual health in Black women and Latinas in a community-engaged research approach. And this is the overall slide, and I'll be going through each step individually. This aim was done in collaboration with the Fibroid Foundation and Washington University. Now, what are uterine fibroids? So they are non-cancerous neoplasms found in the uterus. And in some women, they result in feelings of helplessness, fear, anxiety, and isolation, and a decreased quality of life. They also have some physical manifestations, such as abnormal uterine bleeding and some infertility as well. And so you can see in the picture here in the slide how they look within the uterus. And why is this significant? Well, Black women report having greater symptom burdens from uterine fibroids compared to non-Hispanic white women. So at the time of diagnosis, Black women have more numerous fibroids, larger volumes, and are at a younger age. And so there's a disparity there. But in a 2018 study, we found out that Hispanic Latinas report an even greater symptom burden than both Black and white women. However, there have been no studies besides that study, that 2018 study, looking at Latinas. So looking at this literature, I was interested in looking at how the cultural factors may result in treatment delays. So the objective is to provide insights on the social cultural barriers and facilitators in ethno-racially diverse women around uterine fibroids and menstrual health, and also some recruitment strategies as well. So to answer this objective, we held community engagement studios, which is a research approach that facilitates discussion with community and patient stakeholders for research design. So we started off by developing an interview guide using theoretical frameworks. I used the health belief model. For each studio, we recruited about 5 to 8 patients, and the studio started in itself. So this was a facilitated discussion with the participants, and this was done via Zoom. And we had a trained facilitator hold a discussion. And within these studios, we also had trained note takers who took really detailed notes. And these notes were then analyzed using traditional content analysis. And on the right side, you see the tables of the demographics. We held 2 studios, one with Black women who were diagnosed with uterine fibroids, and the second one were Hispanic Latinas without uterine fibroids. And for both studios, the majority of them were biologically female and identified as female. They were also majority employed, but in the Black women community engagement studio, they had an average age of 47.5, and in Hispanic Latinas, there was a mean age of 39.2. Now, the following slides would be the results. So we analyzed these notes that we took, and then we look for overarching themes. And then there were some sub-themes as well. So the way that you read this table is, so the overall arching theme is a menstrual health literacy. And so there was a lack of, so that's a sub-theme, lack of discussion concerning menstrual health literacy. And that's how the table is in. And then on the right side, we have quotes that help support that. So in the lack of discussion, one of our participants said, we need to make sure everyone is aware that they can have support about having these conversations and having this condition, talking about uterine fibroids. But I was looking at the social cultural factors, we'll go down to the biases, the cultural biases. So one of our participants says that cultures are not good talking about menstrual health because of the sex taboo. And this was really seen in our Latina community engagement studio and concerns about Catholicism. But there was also this normalization of pain of menstrual symptoms. So if we look at the next line below, one of our participants says, in our community, we normalize pain, la mujer sufre, which means that the woman suffers. The other community, another study said as well that Black women think it's normal or acceptable to have these painful periods. So there's this normalization of symptoms of heavy bleeding and physical pain regarding uterine fibroid menstruation that leads to treatment delays in uterine fibroids because these women are unaware of what is normal menstrual symptoms and when they should go get checked out. And there's a specific cultural influences of having to endure this pain and having this cloak of silence to not appear weak. But using these community engagement studios is very important because we provide personal insight of the situations at hand. And this is important in my study because the next step is actually holding a national study with these women about their experiences. And I'm really excited to do this. We also got recruitment strategies as well. So this is just the beginning of the next step of how involving community members in the study. Here are my acknowledgements and my references. My contact information is also on the right corner of every single of the slides. And I would like to thank you all for listening.